Have you ever found yourself lying awake at night, quietly wondering if a habit you've had for years is still healthy after turning 60? Not because you feel embarrassed or guilty, but because you simply want to know the truth. It's a question that thousands of men keep to themselves. Many are comfortable discussing blood pressure, cholesterol, diabetes, testosterone, or even sleep problems. But the moment the conversation turns to masturbation, everything becomes silent. Suddenly there is hesitation. There is uncertainty, and there are far more myths than facts. So today, let's have an honest conversation. What really happens to your prostate if you masturbate every day after the age of 60? Could it slowly damage your health, as many people have claimed for decades? Or could it actually be helping your body in ways most men have never been told? Stay with me until the end, because the medical evidence might completely change the way you think about this subject. And before this video is over, you'll understand how this private habit can become part of a healthier lifestyle instead of something you unnecessarily worry about. Before we continue, I have one small favor to ask. If you're finding this discussion helpful, take just a moment to press the like button. That simple action helps this information reach more men who may be searching for answers but are too uncomfortable to ask the question themselves. And I'd also love to know where you're watching from today. Leave your country or city in the comments below. It's always inspiring to see this community growing across so many different parts of the world. For many years, men have heard countless stories about masturbation. Some were told it weakens the body. Others believed it drains testosterone and energy. Some were warned it causes prostate inflammation. And perhaps the most frightening myth of all was the claim that it increases the risk of prostate cancer. The problem is that most of these beliefs were never built on strong scientific evidence. Many came from cultural traditions. Others were based on outdated medical opinions that modern research has since challenged. Whenever fear replaces facts, people stop asking important questions. Instead of understanding how their body truly works, they begin fighting against their own biology. And in many cases, they avoid behaviors that might actually benefit their long-term health. Fortunately, we no longer have to rely on rumors. Today we have high-quality scientific research that allows us to look at this subject with much greater confidence. Throughout this video, I'm going to explain exactly what modern studies have discovered about daily ejaculation, prostate health, and healthy aging. I'll explain everything exactly as I would if you were sitting across from me in my office. No judgment, no embarrassment, just honest medical information presented in a simple and practical way. For those of you who are new here, my name is Dr. Rose. I specialize in men's health, and over the years I've spoken with countless men who all quietly ask the very same question. Interestingly, most never mention it during the beginning of their appointment. We usually finish discussing medications, blood tests, cholesterol, blood pressure, and routine checkups first. Then, just before leaving, they'll lower their voice, lean forward slightly, and ask something like, "Doctor, am I hurting myself if I still masturbate at my age?" If you've ever wondered the same thing, you're certainly not alone. So let's replace uncertainty with real medical evidence. Back in 2016, researchers at Harvard University published one of the largest and most respected studies ever conducted on this topic. The findings appeared in the Journal of the American Medical Association Oncology, commonly known as JAMA Oncology. The researchers followed more than 31,900 men over a period of approximately 18 years. Most of these participants were middle-aged or older, making the study especially relevant for men over 60. The researchers asked one very straightforward question: how often do you ejaculate? Then they carefully tracked which participants eventually developed prostate cancer over the years. The results surprised many experts. Men who ejaculated more frequently showed significantly lower rates of prostate cancer than those who ejaculated less often. More specifically, men who ejaculated 21 times or more each month experienced roughly a 33% lower risk of developing prostate cancer compared with men who ejaculated only 4 to 7 times per month. That is not a small difference. That is a finding that deserves serious attention. Now let's pause for a moment because this point is extremely important. This was not an online survey. It wasn't based on opinions shared on social media. It wasn't designed to promote a product or sell a supplement. It was a carefully conducted, peer-reviewed scientific study. The researchers adjusted for important factors, including age, lifestyle habits, and medical history, to make the results as reliable as possible. Their goal wasn't to prove a popular belief. Their goal was simply to follow the evidence wherever it led. And the evidence consistently pointed toward one conclusion. More frequent ejaculation appeared to protect the prostate rather than damage it. Naturally, that raises another important question. Why would something so simple have such a positive effect? The answer begins with understanding one of the prostate's most important jobs. Your prostate produces a significant portion of the fluid that becomes semen. When ejaculation does not occur for long periods of time, those secretions remain inside the gland. Over time, stagnant fluid may contribute to increased oxidative stress and create conditions that encourage irritation and inflammation. Think of it this way. Imagine leaving water sitting inside a garden hose for weeks without ever turning on the tap. Eventually, debris begins collecting. The water becomes stagnant. Everything inside becomes less clean than it should be. Now compare that to regularly running fresh water through the hose. The old water is flushed away. The hose stays cleaner. The same basic principle applies to the prostate. Regular ejaculation helps remove older secretions and allows fresh fluid to replace them. From a biological standpoint, this may reduce unnecessary pressure inside the gland. From a practical standpoint, it helps maintain a healthier internal environment. And emotionally, understanding this process often brings enormous peace of mind to men who have spent years worrying that they were somehow harming themselves. It may even reduce the likelihood of uncomfortable inflammatory conditions such as prostatitis, which can affect quality of life as men grow older. But keeping the prostate healthy doesn't stop with simply clearing old fluid. There's another important reason why regular ejaculation may support men's health after the age of 60. It helps reduce inflammation while lowering the body's stress response. Every time you reach orgasm, your brain releases a combination of natural chemicals that help you relax. At the same time, your body lowers the production of cortisol, which is commonly known as the primary stress hormone. Now, you might wonder why cortisol matters so much as we grow older. The answer is actually quite simple. Chronically high cortisol levels have been linked to persistent inflammation, elevated blood pressure, weakened immune defenses, poor sleep quality, and a greater risk of many age-related health conditions. For men already dealing with an enlarged prostate, chronic inflammation often plays a major role in worsening urinary symptoms. That's why reducing unnecessary inflammation becomes increasingly important with age. Several studies published through PubMed and the National Institutes of Health have shown that healthy sexual activity is associated with lower levels of systemic inflammation throughout the body. This doesn't mean ejaculation is a cure. It simply means it may become one helpful piece of a much larger picture of healthy aging. The benefits are not only physical. Many of my patients describe feeling noticeably calmer afterward. They become more patient, less irritable, more emotionally balanced throughout the day. That isn't simply their imagination. Those changes reflect real biological processes taking place inside the body. Now let's move to another benefit that often receives very little attention. Healthy blood circulation. As men get older, circulation naturally becomes less efficient. Blood vessels lose some of their flexibility. The amount of blood reaching different tissues slowly declines. Most people immediately think about erections when they hear this, but blood flow is equally important for maintaining healthy pelvic organs, including the prostate itself. During sexual arousal and ejaculation, circulation throughout the pelvic region increases. Fresh oxygen-rich blood reaches the surrounding muscles, nerves, glands, and connective tissues. That steady circulation helps nourish these structures while supporting their normal function. I often compare this process to regular physical exercise. When you exercise your legs, shoulders, or heart, you're keeping those systems active and healthy. Your reproductive organs also benefit from regular healthy activity. Without movement, tissues gradually become less efficient. Circulation slows. Nerve function becomes weaker. Healthy activity helps preserve normal function over time. For many men, this improved circulation may contribute to better urinary control, healthier erectile function, and less pelvic discomfort as they continue aging. Now let's discuss another important area that many people misunderstand: hormones. The male body operates through a carefully balanced hormonal system. Testosterone doesn't simply control sexual desire. It also influences muscle strength, energy levels, mood, motivation, bone density, and overall well-being. Regular ejaculation appears to help maintain a healthier hormonal rhythm for many men. The body naturally adjusts and regulates hormone production through a variety of biological feedback systems. Maintaining regular sexual function becomes part of that ongoing balance. Many men tell me they feel more relaxed afterward. Some notice clearer thinking. Others describe feeling emotionally lighter. These experiences are supported by the natural release of dopamine, oxytocin, endorphins, and several other chemical messengers produced by the brain. Again, this isn't magic. It's physiology. It's simply how the human body was designed to function. Now, I'd like to mention one final benefit that often surprises people because very few doctors discuss it openly. Regular self-examination creates familiarity with your own body. When you regularly pay attention to your reproductive health, you naturally become more aware of what feels normal. That awareness can be incredibly valuable. Over the years, many men have discovered small lumps, swelling, unusual tenderness, changes in the testicles, or other abnormalities simply because they noticed something different during normal self-care. Early detection has saved countless lives. Recognizing a change early often leads to earlier treatment and much better outcomes. So becoming familiar with your own anatomy isn't something to feel embarrassed about. It's actually a responsible part of protecting your health. However, I also want to be completely honest with you. Masturbation is not some miracle solution that automatically guarantees a healthy prostate. It should never be viewed that way. Think of it as one helpful tool inside a much larger health strategy. If someone ejaculates every day but eats a poor diet, never exercises, sleeps only a few hours each night, and lives under constant stress, that single habit cannot overcome all of those unhealthy lifestyle choices. True prostate health is built through daily habits working together. And that brings us to the next part of our discussion. Let's look at several additional daily routines that research continues to associate with a healthier prostate. The first begins with something every single one of us does every day: the foods we choose to place on our plate. The prostate is surprisingly sensitive to nutrition. Certain nutrients appear to protect it, while others may increase inflammation over time. One of the most extensively studied nutrients is lycopene. Lycopene is a powerful antioxidant, naturally found in tomatoes, watermelon, pink grapefruit, and several other red-colored fruits. Research suggests that lycopene helps reduce oxidative stress inside prostate tissue. Oxidative stress refers to damage caused by unstable molecules known as free radicals. Over many years, excessive oxidative stress may contribute to cellular injury and increase the risk of disease. Large observational studies have shown that men who regularly consume higher amounts of lycopene appear to have a lower risk of developing aggressive forms of prostate cancer. Although no single food can completely prevent disease, Consistently eating antioxidant-rich foods gives your body valuable support over the long term. And lycopene isn't the only nutrient worth mentioning. Green tea contains natural compounds called catechins that have strong anti-inflammatory properties. Cold water fish, such as salmon, provide omega-3 fatty acids, which help support cardiovascular health while also reducing inflammation. Cruciferous vegetables including broccoli, cauliflower, Brussels sprouts, and cabbage contain natural plant compounds that assist the body in maintaining healthier hormone metabolism. Little by little, these everyday food choices influence the environment inside your prostate. What you consistently eat matters just as much as many of the daily habits we've discussed so far. Because in medicine, lasting health is rarely created by one dramatic action. It's almost always built through small decisions repeated every single day. Now let's continue with another habit that is often underestimated but has a tremendous impact on prostate health. Daily movement. One of the simplest things you can do for your body is also one of the most powerful. Movement keeps blood circulating. And healthy circulation keeps tissues alive and functioning properly. As we get older, many men naturally become less active. Retirement, joint pain, desk work, or simply developing a slower routine often means spending long hours sitting. Unfortunately, the prostate doesn't benefit from that lifestyle. When you remain seated for extended periods, especially with poor posture, blood flow throughout the pelvic area gradually slows. Less circulation means less oxygen reaches the tissues. Nutrients are delivered less efficiently. Waste products are removed more slowly. Over time, this sluggish circulation may contribute to discomfort and may even worsen existing prostate symptoms. The encouraging news is that you don't need to become a marathon runner to experience meaningful improvements. Most men can benefit from something as simple as 20 to 30 minutes of walking every day. A comfortable walk around your neighborhood. Gentle stretching in the morning. Light cycling. Swimming. Even basic mobility exercises performed consistently can make a noticeable difference. The goal isn't intensity. The goal is consistency. Your body responds remarkably well when you continue moving every day. Another form of exercise that deserves attention is pelvic floor training. Many people associate Kegel exercises only with women. In reality, men benefit from them as well. Strengthening the pelvic floor muscles may improve bladder control, reduce urinary leakage, and even support better sexual performance. These muscles help support the bladder, bowel, and prostate. Keeping them strong contributes to healthier function throughout the entire pelvic region. Think of movement as regular maintenance for your body. A machine that sits unused for years begins to stiffen. The same principle applies to our muscles, joints, blood vessels, and even our reproductive organs. Healthy movement keeps everything functioning more smoothly. Now let's discuss another daily habit that is absolutely essential for hormonal balance: sleep. Unfortunately, sleep is often sacrificed in today's busy world. Many older adults assume that sleeping fewer hours is simply a normal part of aging. While sleep patterns certainly change over time, consistently poor sleep should never be accepted as harmless. Your body performs some of its most important repair work while you sleep. Deep sleep is the period when testosterone production reaches its highest levels. It's also when damaged tissues begin repairing themselves. Inflammation is reduced, the immune system becomes stronger, and the brain organizes memories while restoring mental clarity. When sleep is consistently interrupted or shortened, testosterone production gradually declines. Lower testosterone may contribute to reduced energy, loss of muscle mass, increased abdominal fat, lower libido, reduced motivation, and slower recovery after physical activity. Poor sleep also increases cortisol. As we discussed earlier, excessive cortisol promotes inflammation throughout the body, including inside the prostate. This creates a cycle that becomes increasingly difficult to break if healthy sleep habits are ignored. Fortunately, Improving sleep doesn't always require medication. Sometimes a few simple adjustments produce meaningful results. Try avoiding caffeine after early afternoon. Coffee consumed late in the day may remain in your system much longer than many people realize. Keep your bedroom cool, quiet, and as dark as possible. Limit television, phones, tablets, and bright screens during the hour before bedtime. Blue light suppresses melatonin, the hormone that prepares your brain for restful sleep. Some individuals also benefit from natural options like magnesium or tart cherry juice after discussing them with their healthcare provider. Small changes repeated every evening often produce surprisingly large improvements over time. Better sleep supports healthier hormones. Healthier hormones support a healthier prostate. Everything inside the body is connected. Now let's turn our attention to another major factor that quietly affects millions of older men: inflammation. Unlike an obvious injury, chronic inflammation often develops silently. Many men don't realize it's happening until symptoms begin interfering with daily life. Persistent inflammation has been associated with enlarged prostates, urinary difficulties, metabolic disease, cardiovascular problems, and many other chronic illnesses. The important thing to understand is that inflammation isn't always caused by infection. In fact, lifestyle habits are often responsible. Eating excessive amounts of refined sugar, highly processed foods, smoking, excessive alcohol, poor sleep, chronic emotional stress, lack of physical activity. Over time, these factors continuously stimulate the body's inflammatory response. Research has repeatedly shown that anti-inflammatory lifestyles may improve prostate symptoms to a degree comparable with certain medications in selected individuals. That doesn't mean medication isn't necessary. Rather, it highlights how powerful daily habits truly are. Fresh vegetables, healthy fats, whole grains, lean proteins, regular movement, stress management, adequate sleep. Each one contributes to lowering unnecessary inflammation throughout the body. And yes, regular ejaculation may also support this process, but only when it becomes part of an overall healthy lifestyle. One positive habit cannot completely erase the effects of several unhealthy ones. Your body responds to the complete picture, not just one individual behavior. That's why I always encourage my patients to stop searching for a single miracle solution. Instead, focus on building routines that support each other. Those routines create lasting health. Not quick fixes. Now I'd like to talk about something that doesn't appear on blood tests. You can't measure it with a scan, and yet it affects the body more than many people realize. I'm talking about shame. For decades, countless men were raised believing that masturbation was something dirty, something immature, something that responsible adults should never talk about. Many carried those beliefs into later life. Even today, I meet intelligent, healthy men who still feel guilty every time they experience a completely normal biological urge. The truth is that emotional burden doesn't stay inside your thoughts alone. It influences your body as well. Long-term guilt and chronic emotional stress increase cortisol levels. As we've already discussed, elevated cortisol contributes to inflammation, weakens immune function, disrupts hormone balance, and negatively affects overall well-being. Your emotional health and your physical health are deeply connected. One cannot truly thrive without the other. This is why I encourage men to replace fear with understanding. There is no benefit in carrying unnecessary shame for something your body was naturally designed to do. That doesn't mean masturbation should become excessive or compulsive. Balance is always important, but when practiced in a healthy, mindful way, without obsession and without guilt, it can simply become another normal part of caring for your body. Accepting your biology doesn't make you weak. It makes you informed. And informed decisions almost always lead to better health. Now let's address another question I hear quite often. Many men ask me, "Doctor, What if I already have high blood pressure? Others ask about diabetes. Some are living with an enlarged prostate, also known as benign prostatic hyperplasia. Naturally, they wonder whether regular ejaculation could make these conditions worse. For the vast majority of men, the answer is reassuring. Moderate masturbation does not appear to worsen high blood pressure. It does not damage the prostate. And it does not make diabetes more severe. In fact, because orgasm temporarily lowers stress while encouraging healthy circulation, many men may actually experience indirect benefits. Better blood flow, greater relaxation, improved emotional well-being. All of these factors support overall health. However, there are a few important exceptions. If you've recently undergone prostate surgery, your recovery instructions may be different. Your surgeon may recommend avoiding ejaculation for a certain period while healing takes place. Likewise, some prescription medications can affect sexual desire, erections, ejaculation, or blood circulation. If you're taking medications for prostate enlargement, heart disease, depression, or hormone-related conditions, it's always wise to discuss any concerns directly with your healthcare provider. Every individual is different. Medical advice should always be personalized. That's why conversations with your own physician remain so valuable. This video is designed to educate you. It should never replace an examination, proper diagnosis, or individualized medical guidance. Now let's bring everything we've discussed together. For many years, masturbation has been surrounded by misunderstanding. Some people viewed it as harmful. Others believed it permanently weakened the body. Modern research paints a very different picture. Current scientific evidence suggests that regular ejaculation may actually support prostate health when practiced in moderation as part of a healthy lifestyle. It may help reduce inflammatory buildup. It may assist in clearing older prostate secretions. It encourages healthy blood circulation throughout the pelvic region. It supports normal nerve activity. It contributes to healthier hormonal balance. And according to long-term research, it may even be associated with a lower risk of prostate cancer. Those are meaningful findings. But it's equally important to remember that this habit alone is not enough. Good nutrition remains essential. Daily movement matters. Quality sleep matters. Managing stress matters. Maintaining a healthy body weight matters. Avoiding smoking and limiting excessive alcohol matter too. These habits work together. One healthy choice strengthens another. Over time, those consistent daily decisions build a stronger foundation for long-term wellness. The prostate responds to the overall environment you create inside your body. Every meal, every walk, every night of quality sleep, every effort to reduce stress, every healthy decision contributes to that environment. So rather than searching for one miracle answer, focus on creating a lifestyle that allows every part of your body to function at its best. That's where lasting health is built. And that's the approach I recommend to every patient who walks into my office. So after looking carefully at everything the research tells us, what conclusion should we honestly take away from today's discussion? The answer is actually much simpler than many people expect. Daily masturbation is not a dangerous habit that automatically damages your prostate. For most healthy men, especially those over the age of 60, current scientific evidence suggests the opposite may be true. When practiced in moderation, without compulsion, and as part of a healthy lifestyle, it may become one of the simplest natural habits that supports long-term prostate health. Instead of causing harm, regular ejaculation may help reduce inflammation. It may assist in clearing accumulated prostate secretions. It supports healthy blood circulation throughout the pelvic region. It helps maintain normal nerve function. It contributes to healthier hormonal balance. And according to one of the largest long-term studies available, it may even lower the risk of developing prostate cancer. That's an important message, because for far too long, fear has spoken louder than science. Many men have spent years worrying about something that modern medical evidence simply does not support. The goal isn't to encourage excess, nor is it to tell every man that daily masturbation is absolutely necessary. The real goal is understanding. When you understand how your body works, you make decisions based on knowledge instead of anxiety. That confidence alone can improve your quality of life. But before we finish, I want to leave you with one final reminder. Your prostate doesn't depend on one single habit. It depends on the way you care for your entire body every single day. Choose foods that reduce inflammation. Stay physically active. Protect your sleep. Manage emotional stress. Keep your weight within a healthy range. Stay properly hydrated. Attend regular medical checkups. And never ignore symptoms such as blood in the urine, persistent pelvic pain, difficulty urinating, or sudden changes in bladder habits. Those warning signs deserve professional medical evaluation without delay. The earlier a problem is identified, the better the chances of successful treatment. Remember, growing older doesn't mean accepting poor health. Age is simply another stage of life. With the right habits, many men continue enjoying strength, confidence, independence, and an excellent quality of life well into their 70s, 80s, and beyond. Small improvements repeated consistently often produce the biggest results. Your future health is built by the choices you make today. So if you've been carrying unnecessary guilt or uncertainty about this topic, I hope today's conversation has helped replace those feelings with clarity. Medicine continues to evolve. Our understanding grows stronger every year, and the more we learn, the more we realize that honest conversations are often one of the most powerful forms of prevention. Thank you for spending these few minutes with me today. I truly appreciate your trust. If you found this discussion helpful, please take a moment to press the like button. That simple click helps this information reach more men who may need reassurance but have never felt comfortable asking these questions. If you're new to the channel, don't forget to subscribe and turn on notifications so you never miss future conversations about men's health, healthy aging, prostate care, hormones, nutrition, and the latest evidence-based medical research. I'd also love to hear from you. What was the most surprising fact you learned today? Share your thoughts in the comments below. I read as many of your comments as possible, and your questions often inspire future videos. Until next time, continue taking care of yourself. Protect your health one habit at a time. Stay active, stay informed, stay hopeful, and remember, the best investment you'll ever make is the one you make in your own body. I'm Dr. Rose. Thank you for watching, and I'll see you again in the next video.